We are going to move on to our last speakers as we conclude our evening. We're very excited to have our final speakers with us because this topic is something that comes up very frequently before, during, and after treatment for cancer. I know our teams address it often. Our final speakers this evening are Haley Longo, Jenn Miller, and Jacki Sawyer, who are all PharmD students in the Department of Pharmaceutical Sciences. They'll be talking about the use of vitamins and supplements, and particularly the intersection of the use of these meds with cancer therapies. Thank you all for being with us this evening.
Hi, thank you for that introduction. My name is Haley Longo. I am one of the pharmacy residents, and today I'm going to be presenting with my two co-residents, Jenn Miller and Jacki Sawyers. And today we're going to be talking about supplements and cancer therapies, immune boosters, or treatment busters. So today we are going to be talking about what to do when starting a new supplement, and then we're going to be reviewing some of the risks and benefits associated with various supplements that are thought to be immune boosting, such as zinc, vitamin C, vitamin D, turmeric, elderberry, and echinacea. So first, I just wanted to start out with talking about the term immune booster. So can supplements really boost our immune system? I think this term is really been a buzzword, especially during COVID and over the past year, where many companies and manufacturers have been really marketing that these supplements and nutrients can provide you with immunity against infections. But is that really scientifically possible? Can these supplements really boost the immune system? And that terminology really isn't scientifically proven. What happens is these supplements are required for our body to naturally make our infection fighting cells. The only way that our immune system is really boosted is when the body sees a foreign antigen, so like a bacteria or a virus in our body. That's when our immune system is boosted. But these supplements are really just giving we get them in our diet, usually daily. So they're really just providing extra nutrients to create natural cells in our body. Next, I want to talk about how do we pick which products when we're at CVS or Walgreens. There's so many different herbal products and supplements. How do we decide which one to pick? So just to note, most prescription medications are heavily regulated by the FDA, and they have to go through a lot of quality assessment. They have to go through rigorous screenings. They have to have good manufacturing practices. They're very highly regulated, whereas herbal supplements and vitamins do not have to go through that process. So there are a couple third-party vendors that do go through and make sure that the products are verified for quality and that their labeling is actually accurate. So we always recommend that whenever picking a product that's at CVS or Walgreens or at your local store, that you look for these two different seals on the packaging. So it can be USP or consumer lab marketing. That just ensures that it's been manufactured correctly and properly, and all the labeling is very accurate and the substances are pure. And then, like we'll talk about throughout the presentation, we always recommend that you seek advice from your pharmacist or physician before you start any new products, just to ensure that there's no interactions or any worsening side effects that can occur. Open communication is definitely key when starting any of these products. Next, we'll talk about some of the supplements. So zinc is our first supplement. It's naturally in our body used to create many different types of cells. And it's thought to be commonly used for fighting the cold. So we think of those zinc lozenges. There's been studies that have been seen that if you use a zinc lozenge within the first 24 hours of a cold, that it can hopefully help decrease the duration of your cold. Other things that has been studied for use is to help prevent some of the side effects of radiation, to hopefully help prevent some of the taste alterations or mouth sores that can occur. Although these studies haven't been done in really large amounts of patients, there is some literature to say that it can have some benefit. Also has been seen to be used in arthritis as well. But zinc is commonly in our diet. So most people in North America do not have zinc deficiencies. So a lot of times we can get it from our natural diet with meat, fish. A lot of the cereals are zinc fortified. So most patients don't need to have extra zinc in their body because we usually get it mostly from our diet. There are some side effects that can happen with taking the zinc. So with people who are taking high amounts of zinc over a long period of time, over a couple months, they can have some copper deficiencies. So this occurs because there's decreased absorption in the stomach of the copper when you're taking the zinc. But usually that only occurs if you're taking it for a prolonged period of time. Commonly, patients will say that they have some nausea, they can have diarrhea with the zinc, or some taste disturbances as well. The big drug interactions that we think of are with some of our common antibiotics, such as levofloxacin, ciprofloxacin, or doxycycline. They can interact with zinc and actually decrease the absorption of the antibiotics. So we want to make sure that the antibiotics are working to really fight our infections. So if any patients are actively taking zinc for a medical reason, we'll just have them separate the zinc from about 2 hours before or 4 hours after they're taking those antibiotics. It can also interact with some of the other vitamins and minerals as well, such as iron supplements. So we'll just always tell our patients to make sure that they're separating them, the zinc from the other supplements too. There's some theoretical drug interactions as well with immunotherapy and cisplatin. So we always just recommend that if you're taking zinc at home, just run it by the physician and your pharmacist just to make sure there's no possible drug interactions. We want the chemotherapy to be working as good as possible. Next, I'm just going to pass it off to my co-resident Jacki, and she's going to review some of the other common supplements.
So I'll begin with vitamin C. So vitamin C does naturally occur in foods such as guavas, bell peppers, oranges, and strawberries. This vitamin helps with the development and repair of all the cells and tissues within your body. So this is healthy for you when it's consumed from your diet. However, in dietary supplements, it's often given in higher amounts. So some common uses for vitamin C include the prevention and treatment of the common cold, treatment of upper respiratory infections, improvement in heart health, healing of wounds, and then the treatment and prevention of cancer as well. So when taken in high amounts in things such as over-the-counter supplements, you may experience nausea, diarrhea, stomach cramps, and very rarely it may actually affect your kidneys. So high doses of vitamin C have the potential to make your chemotherapy less effective when it's taken during. Notably, if you're receiving agents such as doxorubicin, vincristine, cisplatin, methotrexate, or imatinib. Thus, we would advise you to talk to your doctor before beginning the supplement while you're on chemotherapy. So vitamin D is another one that commonly comes up as well. So vitamin D is supplied to the body via UV rays from the sun. However, this is not feasible in a lot of cases, especially if you live in Chicago in the winter, you may not see the sunlight as much. And of course, we would always advise wearing SPF if you're out in the sun for multiple hours or long periods of time in general. So this supplement can be very beneficial, especially in patients that are deficient. So talk to your doctor about potentially checking your vitamin D levels, as the risk of having low levels does actually increase the older that you get. So vitamin D supplements are commonly used for cancer prevention, immune regulation, osteoporosis, multiple sclerosis, and then has potential for seasonal affective disorder as well. So if you're taking vitamin D, you could potentially experience things such as nausea, vomiting, levels of calcium could potentially get too high, or even bone loss if it's given in high doses without that added calcium as well. However, that being said, there are very few drug interactions with vitamin D, none of which are significant in regards to chemotherapy. So because there are some of these side effects, as I discussed, the bone loss as well, we would advise only taking this supplement under the guidance of the doctor, especially when you are vitamin deficient. And lastly, the one that I'll cover before I pass it over to Jen is turmeric. And this commonly comes up in clinic as well, because it does have some claims for anti-inflammation effects. So This is often found in Middle Eastern dishes. And similar to vitamin C, when consumed in the diet as turmeric, that can be beneficial. However, when taken in a supplement, it often has these very high doses of turmeric that far exceed any amount that you could potentially get from your diet. So again, some common uses for turmeric include prevention of cancer, treatment of infection, the reduction in inflammation, as well as the treatment of joint pain. So if you're taking turmeric supplements, you could potentially experience nausea and stomach discomfort, diarrhea, and then very rarely it can cause some skin irritation as well. So although when consumed in your diet, the interactions are very limited as far as drug interactions go. However, again, when you're taking it as a supplement, you may be taking up to 6 times the dose that you may actually be getting in your diet. So turmeric does block an enzyme that breaks down many drugs, and this can lead to those interactions in chemotherapy. So notably with agents such as doxorubicin, paclitaxel, and cyclophosphamide, among many others as well. And it can actually increase the side effects that you get from your chemotherapy. Notably, the neuropathy and paclitaxel potentially be increased in patients taking turmeric. Additionally, it may also block that enzyme that's breaking down some of your drugs that you're taking on a daily basis, such as things for mood or pain, and can make them less effective as well. So therefore, we would recommend avoiding the supplement unless discussing with your doctor first, and instead consuming it within your diet. And now I'll pass it off to Jenn.
Hi everyone, so I'll be talking about the last 2 supplements today, which will be elderberry and then echinacea. So elderberry is one of these supplements that can kind of come in multiple forms. One of them that I've commonly seen patients have are these gummies, and then patients also frequently obtain it through things like herbal and supplement teas. So it's just important to always take a look at some of the teas that you may buy at the grocery store just to make sure that it doesn't contain any of these extra ingredients like these supplements. But patients have claimed to use their elderberry for things like preventing heart disease, immune system support, as well as treating constipation, and then other more general things just like reducing inflammation, whether that's from injury, from just kind of a lot of things going on, or if patients just generally want to take it because they've heard it's an antioxidant. So this one can have some side effects. Generally, it is commonly well tolerated, but it does have some side effects that patients can experience. Some of these, it can be hard on the stomach for some people, causing some nausea and maybe some vomiting. There were also a few case reports of allergic reactions to elderberry, but if patients do experience that, that would be something that would commonly occur in the first couple times that you would take the supplement. Additionally, patients have noticed increased urine output and increased diarrhea with their elderberry, which does make sense as some people do use this to treat their constipation. So this is just something to be aware of in case patients do experience, increased diarrhea or increased urine output or even some vomiting. Just because all of that just means that you're losing some fluids and you can become dehydrated because of that. So it's always just important if you are taking this, just to make sure that none of these things kind of increase in volume, just so that you're not getting dehydrated. And then there also is one interesting caveat with this one too. Raw elderberries can contain cyanide, which can eventually lead to cyanide poisoning if you take enough elderberry. However, most of the products over the counter, including some things like teas, have all manipulated the elderberries so that they're not raw. So this generally is not a concern, but just is something that you may hear about with elderberry. Drug interaction wise, it can have an effect with some chemotherapy, like doxorubicin and daunorubicin. The chemotherapy sometimes works in a way in which it relies on some of those oxidants from building up, whereas elderberry kind of reduces all that in that it is an antioxidant. So it may just impact the ability of the chemotherapy to work. Additionally, if you're already on stool softeners or laxatives, that can just further increase the amount of diarrhea that you're experiencing. And in patients who are taking medications for diabetes to help lower their blood sugar, patients have noticed even lower blood sugars when they take elderberry with these diabetes medications. And then the last supplement that we'll cover today is Echinacea. This is another one that commonly does appear in some of these teas over the counter, especially some of those immune support teas. So again, just something to be aware of when you are deciding on which drink you would like to make that day. So some common uses for this one, and most people do generally use this to help shorten the duration of cold or just as a boosting of the immune system. Some patients will also use it to help kind of speed up their wound healing, but this kind of just further goes to the point of the immune system and healing that patients may see with Echinacea. However, this one, kind of like all of the other supplements, can have some possible side effects as well as some drug interactions. This one, in terms of side effects, seems to be a little bit more mild than the elderberry. Patients may just notice a headache, maybe dizziness, nausea, constipation. But generally, overall, this one seems to be pretty well tolerated in normal amounts. However, with drug interactions, this one does have some notable ones. So this one, Echinacea, can actually kind of reduce some of our big cell signalers that are responsible for some of the inflammation in our body. And normally that is a good thing, where we don't want inflammation. However, some of our cancer treatments, like immunotherapy, kind of actually rely on those inflammation markers to help get the immunotherapy working. So the Echinacea may actually reduce some of that ability of the immunotherapy. Additionally, Echinacea is actually metabolized by a few specific enzymes in our liver, which I did list out here on the slide for you. But these are the CYP3A4 and then 2C8 and 1A2. And what all that jargon just kind of means is that we do have these specific enzymes to kind of get rid of the Echinacea from our body. But a lot of drugs that we give for other reasons are also metabolized by these same enzymes. So because of this, we can see some drug interactions with Echinacea and other medications, for example, like tamoxifen and etoposide. So the Echinacea is one where we would really encourage you to talk to your oncology team before starting this one. So then just for some takeaway points for everyone, again, one thing that we've really tried to hammer home tonight is talking to your team before wanting to start any new herbal or supplement, just to make sure that it is appropriate for you and that you won't see any drug interactions with your cancer treatments. Additionally, obtaining a healthy amount of zinc, vitamin C, and vitamin D in your diet is recommended and not likely to affect your cancer treatments. And then lastly, turmeric, echinacea, and elderberry can have some major interactions with your chemotherapy or with other medications that we're using to treat your cancer or for other side effects of the cancer. And again, so for these reasons, we would just like you to talk to your team before deciding to take one of these. And so we'd be happy to answer any questions you guys have.
Thank you so much. I think I'd like to start the Q&A session by first apologizing. I think I introduced the three of you as students, and I realized my mistake. You guys are all residents, you're PharmD residents in the Department of Pharmaceutical Sciences. And one of the comments that we had in our chat was that an attendee mentioned that they bring this information to their physician, but they don't really have a lot to say about supplements. And I think this would probably be a good time in the program to just talk a little bit about how the pharmacy residents and our PharmDs work in concert or collaboration with our oncology teams.
Sure, yeah, that's a great question. So most of the oncology clinics now do have a pharmacist that is a member of the team. We are still working our way into some of those clinics, but most, at least not, if not all of the oncologists do have access to a pharmacist who specializes in oncology to ask about these medications. But the pharmacist regularly in clinic on a daily basis reviews every patient that's coming into clinic that day. We do usually screen patients' medication list for drug interactions. We look at patients' labs every day. And we really work with the physicians and nurse practitioners and PAs in clinic just to make sure that the patients are getting the appropriate treatment at the right dose and that there aren't any drug interactions. So we're not always front and center and seeing the patient at every visit, but almost every time a patient comes into an oncology clinic at Northwestern, a pharmacist is looking at their chart.
Thanks so much for that great summary. It's, I think, important for our attendees to know that they have pharmacy experts at, as part of their team and accessible for answering questions. This is a fascinating question. If I'm wearing sunscreen and go in the sun, does my body still make vitamin D?
Yes, yeah, it will still. The SPF kind of just works to, it'll reflect some of the direct sunlight and some of the toxic UV rays that we can have to kind of form a little layer, form your skin, but you can still absorb some of the vitamin D that you get with sunscreen.
And then I think we have one more minute. I think we're going to, we have a couple quick questions. What are your thoughts on juicing to detox from chemotherapy treatment or treatment? And are there any benefits to drinking celery juice to cleanse?
Sure. I personally don't have any expertise with the celery juice. Generally with juicing though, it kind of has to be taken into context in that I wouldn't recommend having the juice being your only source of vitamins or minerals or sustenance for the day. It's still important to make sure that patients are getting in enough calories to kind of keep their strength as much as they can. In terms of juicing though, I think as long as it's, you know, maybe like one juice a day, I think would be enough in terms of just vitamins and minerals. I don't think patients necessarily have to juice for every meal and have their green smoothie for 3 meals a day. But it is a good way to get in minerals and vitamins.
And then does turmeric increase estrogen in your body?
Sorry, I will defer to Jackie for that one.
And I don't know if it directly affects your estrogen. We just know that a lot of the medications that you're taking, that it can specifically affect the metabolism of a lot of different medications. So it directly blocks an enzyme in your liver, that multiple enzymes in your liver that can cause interactions with multiple medications. So it would really depend on what your medications looked like, but specifically estrogen, I would have to look more into.
I'm going to ask one final question. The presentation was great, you guys. Thank you so much. Could you speak to that balance of calcium and vitamin D? How much calcium is needed to balance or enhance the vitamin D supplementation?
So for the most part, we usually recommend patients to take 1,200 milligrams of the calcium and 800 of the vitamin D at least, to have that balance. There's some literature to suggest that just the vitamin D can cause more bone turnover and not really replenishing it the way that we want. So we kind of want to have that healthy balance of both calcium and vitamin D to both do their job at the same time to really build up that bone to make it strong.
Okay, I lied. I am going to sneak one more question in because we hear this question as nurses over and over again. Do you have to avoid soy if you have an estrogen positive breast cancer?
Yes, I generally recommend avoiding soy as much as you can. I think it's okay to have a little bit here and there in your diet, but I would definitely not recommend taking any like soy supplement where it just has higher doses. But again, a little bit here and there in your diet is okay.
Sure. That's all I have for you. I thank you so much for such a topical and frequently asked questions in terms of what we see day to day with our patients. And you've really answered a lot of the questions that come up repetitively. So thanks you guys for coming together as a group and giving us this broad overview of vitamins and supplementation. We appreciate the time and attention you've given us tonight.
Great. Thank you so much for having us.
Thank you. Thank you.